Welcome to the Elizabeth Scott Community, one of the few retirement and long-term care facilities that is still family-owned and operated. The Elizabeth Scott Community's roots go back to the 1888 birth of Elizabeth Halpin in Maumee, Ohio. Elizabeth grew up on a Springfield Township farm and was educated in area public schools. After graduating from Holland High School, she received her undergraduate degree from Ohio Northern University and later taught high school at 8 Square School in Holland, Ohio. Elizabeth married Samuel Scott, a cattle farmer, and together they raised 11 children in a farm home that is still an important part of the Elizabeth Scott community. After the death of her husband, Elizabeth Scott became active in the nursing field as a state hospital psychiatric supervisor. She would later become a licensed practical nurse in the field of mental health. In 1949, with the encouragement of physicians and friends, Elizabeth Scott converted her farm home into a home for mild mental patients. It was the first home in Northwest Ohio to be licensed by the state. Elizabeth Scott's farm home was filled to capacity from the beginning because of her reputation of bringing out the very best potential of her patients. Initially, she cared for 5 patients and was later licensed for 22. Elizabeth Scott fought hard for improved state legislation for nursing homes and was one of the 5 original members of the Ohio Nursing Home Association. In 1961, she convinced her daughter, Mary Scott Bucher, and son-in-law, Vern Bucher, to purchase the Riverview Nursing Home in Waterville and to manage it with the same loving care that she displayed in her own nursing home. The Buchers purchased the facility at great personal risk, selling their own home to obtain the necessary funds. They would later change the name to Hillcrest Nursing Home. After getting their feet wet in the nursing home industry, the Buchers purchased the Elizabeth Scott Community in 1976. During their ownership, Mary and Vern expanded the business while maintaining the small, family-owned atmosphere. They employed all 4 of their children, as well as most of their grandchildren, while instilling in them the philosophy of pioneer Elizabeth Scott to care for residents like they were family. Mary and Vern Bucher maintained their ownership until 1992, when their children purchased the business. Elizabeth Scott was indeed a pioneer in the long-term care industry, and she instilled in her children and grandchildren a passion for caring for others. From its humble beginnings in a farmhouse, the Elizabeth Scott Community has grown to offer area residents a continuum of care, including independent living, 2 levels of assisted living, skilled rehabilitation, and long-term care. Today, the Elizabeth Scott Community continues to be both family-owned and family-operated. At age 13, Paul Bucher, the grandson of founder Elizabeth Scott, began learning the long-term care business from the ground up, buffing floors on Saturday morning for his parents' facility, the Hillcrest Nursing Home in Waterville, Ohio. In 1976, Paul officially began his career at the Elizabeth Scott Community, working in maintenance. In 1981, he moved to the administrative area where he assisted his parents in accounting and payroll. Paul, along with his other siblings, purchased the Elizabeth Scott Community from his parents in 1992. He became the sole owner in 2007 and actively functions as the president of the organization, spending long days at the facility. Paul's wife, Deb, has served as the facility's Director of Human Resources since 2007. She began her healthcare administrative career in 1979 at St. Luke's Hospital in Maumee, where she held various roles in the Human Resources Department. Through the years, she worked occasionally at Elizabeth Scott until joining the facility full-time. Deb is responsible for overseeing all employee services, including recruitment, benefit administration, education and training, employment issues, and payroll. Following in the footsteps of his father, Paul, Matt Bucher began learning the long-term care business at an early age. As a young boy, he spent summers pulling weeds and doing yard work. In 1998, at the age of 16, Matt officially began working at Elizabeth Scott when he assumed the duties of mowing the lawns and doing landscape work. He worked part-time in Elizabeth Scott's maintenance department until 2007, when he graduated from Lourdes College with a bachelor's degree in business administration. Matt was promoted to Director of Marketing soon after graduation and works to provide interested families with tours and information about the facility. Jeannie Bucher began her Elizabeth Scott career in 2005, working for 3 years while attending college as a resident assistant in Assisted Living Level 1. It was at Elizabeth Scott where she and Matt met and fell in love. Jeannie graduated from Mercy College of Northwest Ohio in 2008 and began her nursing career at St. Luke's Hospital in Maumee, working in the medical, surgical, and intensive care units. She enjoyed her hospital work but missed the long-term care environment, so she returned in 2009 to Elizabeth Scott as the Assistant Director of Nursing for Long-Term Care. Jeannie and Matt were married in 2008 and are the proud parents of Max, a fifth-generation family member who will one day join the family business. As a young girl, Allison Bucher visited her parents while they worked at Elizabeth Scott, often mingling with staff members and residents. Following in the footsteps of her father Paul and brother Matt, she eventually began working at the facility, doing odd jobs and yard work. Today, she's a busy student, but finds time to work several days a week in the dietary department, helping staff members in the kitchen and dining room. Allison is following the family tradition of caring for others while learning the business from the ground up. From its simple beginnings as a simple 1920s farm home, the Elizabeth Scott community has grown a great deal through the years. In 1976, 2 wings were added to the original farm home. An assisted living facility was built in 1988, and 2 more buildings were added in the early 1990s. A separate 50-bed long-term care facility was added in 1996 and has since become Medicare and Medicaid certified. The most recent addition to the campus are the independent living apartments, allowing Elizabeth Scott to offer a broad continuum of care for its residents. The facility has grown and changed tremendously from its meager roots as a simple farm home. But through the years, one thing has not changed. The Elizabeth Scott community has remained family-owned and family-operated, and ownership has embraced Elizabeth Scott's philosophy of treating residents as if they were family.